as you all know, that advocacy is all about influencing duty bearers or government officials to do what they're required to do for the people. Now, in this project of women empowerment, we have been engaging on a number of activities. And as in our advocacy, the ultimate goal we wanted to see is that there is increased financing on GBV service delivery. We're doing this by monitoring the duty bearers who are implementing or who are mandated by law to implement the GBV policies. We monitor them quarterly, and when we monitor them, we are able to identify the advocacy priority asks or the issues or the gaps that are in the policy. And those are the gaps that we bring to the attention of the duty bearers. When we started the intervention, there was no budget completely on GBV. But now as we speak, to Boy sub-county, there has been an allocation of 2.5 million. In the Bululu sub-county, there has been also allocation of 2 million. In Palam, that is in Katakwi district, which had no budget totally, they also now have 1.5.
They always call upon us to participate in their activities, and the activities called Accountability Forum. Accountability Forum is the activities that they have designed. They have actually trained, they call them advocacy officers. They have always called upon us to discuss how the district is planning in terms of budgeting for specific budget allocation for the GBV activities.
We had a number of successes within our time of working. Amongst them were lobbying for a clinical officer who could be able to support the survivors of GBV. That was in Bobi sub-county. In Bobi Health Center 3, there was no clinical officer who is within the framework of health. He or she is the one who is supposed to fill the police form 3 so that it is able to be sanctioned in the courts of law. Secondly, the office of the CDO Bobi also never had equipment to track record and as well to manage records of GBV cases. So we lobbied through the office of the sub-county chief, who presented the whole issue to the council, and eventually in 2019 as well, there was a laptop procured for the office of the CDO. In addition to that, the LCs in the villages we have been working in, they also never had stationaries to help them keep track of GBV cases in their jurisdiction. Eventually, all LCs in Bobi sub-county and as well in Koro, I can extend to that, also have stationaries, and they are also being recording cases effectively.
For the past years, we've been spearheading the passing of the strategies to the passing of the Sexual Offences Bill. And as you know, it entails a lot of laws that are part of giving justice to the gender-based violence survivors and victims, and many other laws. For example, the Succession Amendment Bill, the Employment Amendment Bill. ACFOD has been part of these drives, and still at national level, ACFOD has built collaborations with different partners at national level, and we get to see ACFOD working with the Ministry of Gender, working with different CSOs. ACFOD is a member of a number of coalitions like the Domestic Violence Coalition and many others that fight against gender-based violence as a key issue. And when the Trocare project came in, it was one way or increasing efforts in the fight against gender-based violence. And we came in with this project of advocacy for implementation of GBV laws and policies. Reason being, the government had enacted these laws, and first of all, implementing these laws was not in place. And then secondly, people lacked knowledge. There's an information gap on these laws, the Domestic Violence Act and the Gender-Based Violence Policy. And this was an opportunity for ACFO to empower the communities, empower the people, and empower the country at large on understanding these gender-based violence laws and policies.
One of our partners, CS Berger, has done a very tremendous work. They do the budget analysis, and so we have used that information to be able to use it to do a lot of lobbying with the policymakers. And that has been tremendous, because IRCU sits on the sector committees, of course, now under the National Development Plan 3. They are programs, but we are members on the community mobilization and the mindset change, and we are able to bring those issues that affect our work, but affect also the other players within the GBV prevention and response network. So we also sit on the steering committee of GBV prevention in Ministry of Gender. So we have been able to raise these issues, and I think some of the responses have been good through our advocacy. The issue of Police Form 3 was a big issue, and we were able to lobby, and 2 years ago the Inspector General of Police told us that they were able to buy a machine now that prints out all those Police Form 3s. And that is a plus for this particular project, because there was strength with every member being able to work on their strength and areas of expertise. And I also want to say, out of it, the referral pathway has been a very good intervention, because then police the DPP's office and courts are seeing the strength of religious leaders working in the prevention of gender-based violence.
In this project, we've been working together with regional partners and other national partners to ensure that the people in the Acholi region and Teso region get to know the laws and policies for starters, and then also put in means of how these laws and policies are going to be implemented.
I think basically the first thing and the only thing that Troke has really done its best in is, one, making people aware that domestic violence is a reality. It is a reality. And it's a program that has to run throughout the country and show people the evils of gender-based violence. Not only that, but at the same time, when you show people the danger, you also to try help people to cover themselves, to be safe. So we have empowered women. They have enabled women to be empowered throughout the country. And in this effort of empowering women, various associations have been formed.
Establishing a national family office, it was not there. So we did not have, we were sitting on the veranda. We did not have a house. So that one has been instituted. Now when we look at women empowerment, and you are training men, the priests, you are training catechists, when the women can be the perpetrators of violence and they are quietly in the house there, they got those also out. We added them in the program. We trained the women. Now the women actually is our anchor to the households. When we want to go to the family, we go via the women. And these women have been trained and commissioned nationally.